All right. Well, welcome to today's Systems for Action Research in Progress webinar. This is a bi-weekly series that we have, and so many of you may have joined us in the past for these presentations. But for those that are new to the series and to Systems for Action in general, we are a national research program office funded by the Robert Wood Johnson Foundation, and we at Systems for Action are housed at the Colorado School of Public Health and the Health Systems Management and Policy Department. At Systems for Action, one of our main activities that we have focused on over the years since we were initially funded in 2015 is to develop and release annual calls for funding. So we're really interested in soliciting ideas from researchers and community-based organizations on innovative ways of aligning across the medical, public health, and social service systems in ways that can improve health equity and population health more broadly. And today you're going to be hearing from a team that was funded from our most recent call for funding opportunities that was released in early 2025. So this is the first time that you're getting to hear from this team in this Research in Progress webinar series about their project that officially started October 2025. So you get to hear a little bit about what they proposed to do in their proposal, about what they've done to date and what they plan to do for the remaining months of their project. So today's presentation is going to be led by the team that is leading this research project. So it's in partnership between the Institute for Health Equity Research and the New York City Civic Engagement Commission. And they're going to be talking to you about their Systems for Action project about participatory budgeting for health equity. Um, I think that is all I'm going to say right now about that project. I know that they're going to give you the whole overview and they can speak to it much better than I can. But before I hand it over to the team, just a few housekeeping items. These sessions are recorded and we share the recording, the PowerPoint slides, and any other resources that are shared during today's webinar after the session. So you will have those delivered in your inbox. And then the last thing is that we do save time at the end for Q&A. So if you have a question that comes up at any point during today's webinar, please locate the Q&A box at the bottom of your screen, pop your question in there, and we'll make sure that we save time to address those questions with the presenters that are here today. We do know that sometimes people put questions in the chat, and we'll do our best to make sure that we're keeping an eye on the chat. But if you do have a question, to make sure that we do see it, it is best to put it in the Q&A box. Okay, with that, I think I'm done. Lula, I'm going to go ahead and hand it over to you to introduce the project and the team and kick it off. Thank you.
Great. Thank you, everybody, for joining. Our project is called Participatory Budgeting for Health Equity, a unified multisectoral approach. Um, and we just wanted to start off with a land and labor acknowledgement. So we acknowledge the traditional lands of the Lenape people on which we conduct our research and the fact that this land was forcefully dispossessed from the Lenape. We support reparations for Indigenous peoples and that they should have a voice in the future of this land with the aim of social and environmental justice. We acknowledge the labor that built the city of New York, the forced labor of enslaved peoples of African descent. Slavery not only built the material foundation of our society as a form of primitive accumulation, but its reverberations continue to be felt today through the widespread disenfranchisement of the descendants of slaves. We support reparations for the descendants of slavery, and our research project seeks to combat systemic racism through participatory democracy, giving people a voice as social and political agents. We also stand firmly for the rights of immigrants and with the movement against ICE that is currently centered in the fight in Minneapolis. We demand justice for Renee Nicole Good, Alex Preddy, Geraldo Lunas Campos, Keith Porter, and all of the victims of the U.S. immigration system. Immigrants are our coworkers, neighbors, and friends, and we believe that their voices should also be centered in the effort towards democracy and justice. I'm going to hand it off to Benjamin.
Benjamin, you're on mute.
Sorry, that was first one. Nobody else be on mute the rest of the time. Thank you, Lula. Nice to be with everybody here today. My name is Benjamin Solitaire, representing the New York City Civic Engagement Commission. As you can see, we were created in 2018 through a ballot initiative. Over 1 million New Yorkers voted to put us in the city charter, and it's the first commission created by New York City voters to restore civic trust and strengthen democracy by promoting inclusive participation. We run a citywide participatory budgeting process, voter language assistance, and we train our community board members. Thank you. Next.
And I'm Neetha Vangipuram, and just wanted to briefly introduce the Institute for Health Equity Research at the Icahn School of Medicine at Mount Sinai. We are a diverse group of collaborators across sectors, communities, and disciplines, and we strive to collect evidence and develop innovative solutions to tackle systemic inequities to improve health in all the communities that we serve, using iterative cycles of inquiry to action. So translating research and data to actual action to improve health equity. Again, you heard myself, Neetha Vangipuram. I work with my colleague, Dr. Devin Madden at the Institute for Health Equity Research. You just heard from Benjamin, who's a senior advisor at the Civic Engagement Commission, Lula O'Donnell, who's our grant project manager. And we are joined today by a representative from one of our community partners, the Circle Keepers, Mule Herrera, who's the People and Program Operations Manager there. Okay. Before we dive into the content, we wanted to start with a couple of quick polls, the first of which will pop up on our screen if Sadina can launch that.
Well, I am attempting to launch it. One sec here.
We saw it before, honest.
Well, we're gonna see if we'll just launch the original one that had two. Oh, it's not
Okay,
letting
nope.
me. Carrington, I'm gonna ask you to see if you are able to. Apologies.
I don't see that one in the polls now. It was there earlier in the practice session.
Well, we'll switch gears here.
Yeah.
We're going to actually post the question in the chat for now since the poll refuses to launch. And that first question that we'd like to ask you all to answer is, do you trust the government? So I'm going to paste the question here in the chat, and if you can just reply directly in the chat and we can all just do a quick survey.
Just yes or no is sufficient.
Yes.
Or
Yeah, yes or no. You can do a reaction. Okay, I'm seeing lots of no's coming in.
Not right now. We see. No, not now. Generally, no. And oof. Great. This was really helpful. Thank you. Depends which level of government, which government. Yeah, we recognize it's a tricky question.
All right, thank you all for participating. One more follow-up question.
And I think we actually can get this one to launch. Okay, here we go.
All right, our second poll. Do you feel policies are better when informed by everyday people? Give us a few seconds for everybody to answer that, and then we will show the results.
people see the poll, it doesn't look like they're answering.
It looks like majority, about 81% of folks have responded. We'll give it a few more seconds. All right, here we go.
All right, we got 96% saying yes, which you can see is a contrast to the responses to the first question. And thank you all for participating. We hope that we will be able to kind of dive into this project and how it hopefully addresses the breakdown, I guess, between trust on one side, but also recognizing the importance of people's voices in deciding the policies and programs that we support.
Right.
All right.
So, yeah, with that in mind, let's get into understanding how this proposal came to be. And that really begins with recognizing that the United States holds a legacy of civic disenfranchisement. After stripping land from indigenous populations, the U.S. and its Constitution was built, as we heard in our land acknowledgement, on the backs of enslaved Black people who had no rights under chattel slavery and whose civic rights, due to Black codes and Jim Crow laws, would remain significantly limited long after constitutional amendments. And throughout our history, voter suppression efforts were rampant across the United States, including in New York State, resulting in prolonged and inequitable resource allocation and social services. And we know that today in New York City, civic disenfranchisement continues, even if it's more covert. Racially and ethnically minoritized New Yorkers continue to confront hurdles when they're registering to vote or accessing polling sites. They're given mis and disinformation meant to intimidate them, and they're subject to lasting effects of redlining and gerrymandering that leaves their interests underrepresented and under-resourced. While deep roots in civic oppression alone have the potential to worsen health outcomes, we also know that there is a legacy of medical and public health disenfranchisement in this country. Examples of this include gynecological experimentation on enslaved women, forced sterilization efforts targeting Latinas, and the U.S. Public Health Service's untreated syphilis study in Tuskegee. And today, many racially and ethnically marginalized people still suffer medical and public health disenfranchisement. Patients often feel patronized, misunderstood, unseen by their healthcare providers, leading to misdiagnoses and a disintegration of trust, sometimes deferring people from visiting doctors altogether. Beyond clinical care, public health is criticized for condescending campaigns that mischaracterize or ignore marginalized people's concerns. And further, we would be remiss not to note that right now, at the hands of our government, ICE is presenting a public health crisis for our immigrant communities and presents a grave threat to the health equity efforts that we've been working for. First, there's the immense psychological toll that their threats are bearing. Some people aren't leaving their houses to get the care they need or even to socialize, another known threat to well-being. And then there's the brutality ICE agents are using on the streets and in detention centers for children and adults alike. Detention centers aren't being held accountable to any standards of screening, treatment, or care, and their inhumane conditions have been reported by Kaiser Family Foundation, researchers at Harvard, and firsthand accounts. Fortunately, people have always pushed back. And you can go to the next slide. So here you can see a few examples of how community-led efforts and mobilization of voices have made changes throughout time, all of which are being threatened today, but thankfully people are still continuing to push. When word broke out that Liam Conejo was refusing to eat the food that was making him sicker in the detention center in Texas, people called for his release, and they were heard. We both believe and know that political voice is a critical driver of health. The fight for a voice in this democracy has always been a fight to live a healthy life in which one's basic human needs are met. In locales where people are actively mobilized against voter suppression, basic health outcomes like infant mortality rates for racially marginalized populations improved. Having a political voice gives people the opportunity to support people, policies, and programs that they trust will benefit their lives and the lives of their communities. Furthermore, patient and community voice is a critical driver for health. A sense of empowerment benefits health outcomes in clinical settings and beyond. We are all here as community-based participatory researchers, and this is a foundational guiding principle across that practice. In community-based participatory research, community members are meant to direct public health efforts alongside academic researchers, bringing their firsthand knowledge as the experts of their health concerns and populations academics and clinicians are often trying to reach. With their voices at the table, health research benefits from more culturally informed study designs that yield results with direct applicability to people's lives. And so it is with all of this in mind that we got curious about participatory budgeting and if and how it might be one piece of the puzzle in advancing health equity.
Yeah, so not perhaps as headline grabbing as some of the images you saw in the fights we've had that we highlighted there, but just I think as impactful in many ways is participatory budgeting. It is a process where community members have a direct say in how to spend part of usually a municipal budget. There could also be a school or a community-based organization but we're giving the direct power of how to spend public money to community members. It was started in Porto Alegre, Brazil in 1989 as an anti-poverty measure, as it says there. And through the mechanism, the projects that people suggested and voted for in that town, it improved sanitation, it improved water quality, and it had a direct impact on reducing child mortality. You can see there by 20%. So it is a process that is put in the hands of people, and it is spread around the world to over 11,000 municipalities. Next slide. You can see here it is literally around the world. Many countries have done this and continue to do it to this day. In North America, you can see in the next slide, it has spread a lot. It was in 2009, it began in Chicago. It spread to New York in 2011 when the city council brought it here with 4 city council members. And it has grown to about half the city council still does it. They do capital funding, which means brick and mortar projects. We'll talk more about our process a little bit, but you can see here it's now spread around the country into Canada. And it happens in many different organizations that do it. It doesn't have to be city or state. It can be schools and community organizations as well. So you can see it's pretty prolific around the country. Next slide. In New York City, when after the many years of the city council process doing it, as I said, the Civic Engagement Commission was voted in as a charter revision and given the task of running a citywide participatory budgeting process so that everybody in New York could have a say in how part of the city budget was spent. Our process here runs the same way that many other processes run around the country, around the world. We spend the fall collecting ideas from residents. So we work with community partners, the Circle Keepers being one, but we have about 80 to 90 community partners that hold sessions throughout the city, reaching into all neighborhoods and all populations, so to get ideas from them directly about how to spend part of the city budget. After we collect those ideas, we bring them to residents in each borough who are applied to be part of a borough assembly, and then they are selected through a random sortition process to about 25 people per borough that spend 20 hours together learning about the needs of their borough, using their lived experience to decide what projects out of all the ones that were selected to actually go on a ballot. We can't vote on thousands of projects, so we end up with ballots of about 10 ideas per borough. And then in the spring, and this year, about April, May, and June, all New Yorkers get to vote. There's no residency requirement. You can be 11 years old or older, and we translate the ballots into 13 languages. Then you can vote digitally and on paper over a course of 6 weeks. And then the winning projects, we fund 5 per borough, roughly, and then 1 in Staten Island because it's a little smaller, but we fund these projects 20 altogether, and we do an RFI for community organizations to implement them. And they work directly with the communities that voted for those projects to develop the programs and then implement them in those communities to serve the residents of New York. You can see a couple of quotes here for people that have been through this process. They'd love to see more city agencies trying to involve local communities and government processes and actually encourage them to be actively involved throughout the ideation and implementation process. More funding should be provided to schools and other educational facilities to provide diagnosis treatments to youth starting in middle school and to provide healthier coping mechanisms and habits. That's relating to a mental health initiative the Circle Keepers did. And then, of course, attention to detail down to a science is a practice I would love to see in other organizations. They haven't seen an agency that executes better than the people's money, just to give us a little shout out there. Next slide. You can see, so when people suggest ideas, just as a way to organize them, we categorize them into different major impact areas. You can see them all here. There's 8 of those. You can see that health and well-being, which is this year had 423 ideas that related to that category, slightly above education. And then, of course, we have the public safety, social services, and so on. I think of health and well-being not only is a direct impact area, but a lot of the other categories involve health and well-being themselves. Arts and culture, parks and recreation, people asking for more access to parks, more activities in parks. So it's all, there's a lot of connection between those. But again, over the last, this is the fourth year, like I said, that of the people's money. And throughout that, health and well-being ideas have always been near the top. Next. We collect surveys about all our participants. This is voting demographics. We had 131,000 people vote in the process last year. You can see we collect a lot of youth. We do a lot of youth outreach, the 11 to 17 range being quite well represented. And then we do a lot of senior outreach too. So of course above 65, but we are well represented in all age demographics. Next. And then people of color, of course, are also well represented in this process, with the majority of our participants being in the Black, African American, or Asian categories. These are self-identified. The other gets a lot of variation, but we really try to reach historically marginalized communities, both by age and race, in our process. Next. This here is an example. Sorry, it was a great photo. So we started those borough assemblies, as I said, it's 125 people across the city. We started them about a week and a half ago. They've done 2 sessions. They have 2 more. They're all working together. This is the first session where we bring everybody into the room together. The next 3 sessions, they meet in their individual boroughs. But you can see here, this is everybody learning about the process. They hear directly from from city agencies with the services they provide. And they spend 5 hours together getting to know each other and kicking off the process. So I thought it was great to, this is such a cheerful photo. This is the end of the day. So this is what they look like after 5 hours of sessions. So next.
I love that. I love that picture, Benjamin. All those people together doing hard work and hearing people's voices and thinking about our city. I love it. So given all of that and our understanding, as noted in the background, that where there is voice, we believe that there can be opportunity. We wanted to obviously dig a little bit deeper. Yes, there's evidence that when people are empowered, engaged, valued for their voices, a healthy, equitable future is possible. And yes, as we also saw in Benjamin's slides, that processes like the People's Money allow people to share suggestions that either directly relate to addressing health concerns or relate to them indirectly by addressing social determinants, such as the request for green spaces or improved housing conditions. Still, participatory budgeting as a mode of civic engagement with the potential to improve health outcomes and advance equity has not been adequately explored as an opportunity to reach our goals. And although there's a vast amount of literature out there about participatory budgeting more broadly and its impact more broadly, there has been little assessment of how it impacts health-related outcomes. And further, there have been no studies that we know of that have included representatives from different sectors in the participatory budgeting process to examine the impact of how this process can shift delivery and financing systems that support these health-related sectors, or the resulting impact on health and social determinants of health outcomes in the United States. And so our research that we'll talk about now really aims to address those significant gaps. And so if we go to the next slide, you can see that we humbly borrowed and adapted RWJF's cross-sector alignment theory of change for our pilot intervention, which we'll talk about shortly. Our proposed intervention brings together leaders from government who oversee the PB process. Obviously, we have Benjamin here, and our friends over at the Mayor's Fund and the New York City Civic Engagement Commission are critical to this, as they are the ones running this project. But we're bringing them together with leaders from multiple additional sectors, including medical, public health, and social services. And our shared purpose is to really examine the feasibility and acceptability of participatory budgeting for directly improving health equity outcomes and creating data systems to evaluate impact on health and inform additional community-driven structural interventions within and across these sectors. So our governance structure, which you'll see on the next slide, really includes and elevates the voices and perspectives of multiple represented sectors and community residents with lived experiences of systemic racism and health inequities. And our anticipated outputs include the promotion of this cross-sector alignment and collaboration, the use of existing and generated data. They've been doing this process, as you know now, for a few years. And so there's a lot of raw data that we're excited to get our hands on. And then the adaptation of the process to strengthen health impacts. So here you can see who makes up our partnership board, including our friends over at the Circle Keepers. And we're so glad that Mule was able to join us today. And you can see that these are the folks who are really the ones advising and giving input into the different pilot studies. We'll be looking at all of the information together and meeting our deliverables together. And with that,
Okay. So just to dive into what our project is about, we, as mentioned in the previous slide, Devin just talked about our partnership board, and I just wanted to reemphasize the amazing opportunity and privilege we have to work with this group. It includes representatives from the biggest health system and biggest network of federally qualified health clinics in New York City, the largest and oldest public health department, in the country, and the large network of social services agencies who work on the front lines every day to help everyday New Yorkers. So we're working with this diverse group of this board to conduct 2 pilot studies. The first is a mixed method study, and it's really to begin to understand the feasibility, acceptability, and potential of this multisectoral process on improving health equity. We will be collecting data from 3 different groups of individuals as part of this first pilot study. First, we developed surveys that we are going to be conducting with our partnership board members themselves early on in the current PB cycle, and again after citywide voting wraps up and later in the spring and funded projects are actually selected, to see if their involvement in the process changes their perspectives about PB's potential impact on health and health equity. The board is also currently helping us to finalize a more detailed survey that we will be conducting with 200 individuals across health, public health, and social services sectors, as well as with community members who either have or have not yet participated in participatory budgeting. And in these surveys, in addition to sociodemographic information, we will be using validated scales and other questions to assess people's level of civic engagement and how it may be related to their perceptions about PB's acceptability and perceived value in terms of impacting health specifically, its feasibility to impact health, and also its potential to amplify voice, dismantle systemic racism, and improve health equity. We are also, as part of ongoing PB process, conducting short surveys with community members participating in the various phases of the current PB cycle, and we'll be sharing some of our initial data from that in an upcoming slide. And then in addition to these quantitative surveys, we'll be conducting interviews in small focus groups to try to really get a little bit more of a nuanced understanding of people's perspectives on these topics. And then we will also be exploring how we can actually potentially evaluate the effectiveness of participatory budgeting on actual health and health equity outcomes in future studies, and what additional resources and structures we might need to do this type of an evaluation, what additional data, what additional partnerships might need to be in place to really understand the actual effectiveness of PB on impacting health and health equity. So that is pilot study 1. And then in pilot study 2, we're really excited to have the opportunity to begin to explore how we can use and repurpose the rich and extensive raw data from both completed and the current PB cycle to really try to inform additional changes and wider health equity impacts within and across the systems that are represented in this project. So as we mentioned, every cycle, the Civic Engagement Commission receives thousands of community members' ideas on how the people's money should be used. And then Benjamin had shared that, the data is cataloged in those impact areas as part of the PB process, but there's really never been an in-depth qualitative analysis of this raw data. So in this pilot project, we will be using a participatory action research approach to do this analysis. First, members of our study team will examine the data and try to synthesize key findings in a process called catalysis. We'll bring these findings to a larger group of people, which includes our partnership board, members of their networks, as well as community members who will take part in facilitated discussions to really begin to understand the data and to think about how the data could actually be used to inform broader policies, programs, and funding decisions across these different systems. In this way, we're really hoping to understand how we can amplify how we can amplify the impact of the available data beyond the PB process itself to these larger systems that affect health and health equity. So after initial discussions, we will host additional online sense-making sessions in smaller groups to try to understand a few things. One, whose voices are representative, who might be missing from the data that we have right now. What does the data tell us about priority health areas for the most vulnerable New Yorkers? And what potential does having access to this data have for more broadly advancing health equity? So we will have some of these small group online discussions, which will then culminate in a collective sense-making summit, where we really dive deeper and ask to consider how can we actually use this data? How might we need to package or visualize it? Who are the potential audiences? Is it the C-suite of the health system? Is it the leadership of the health department? Who needs to see and hear about this data? And how can we actually communicate the information to the audiences about what people really want and need to improve their health? And how can we figure out how to collaborate across systems to maximize the opportunity that this data provides? What additional data would be useful? Does that data exist through other, external data sources, or do we need to collect additional data? And ultimately, if we successfully do this, how will we know that we've ultimately made an impact on health equity? Do we need to have additional data from programs funded past, present, and future through PB or through external mechanisms? And so these are all the things I'm thinking about in this second pilot study. And then I think I'm passing it back to Benjamin to share some of our initial data.
Yeah, so thank you for that. We're in the beginning of this process, as we've explained, but the study process, but the PB process, the people's money is underway. We're about halfway through it. And what we did just to get some initial impact and understanding of what people were thinking was during the idea generation sessions, which again are held with about 20 to 30 people per workshop, we worked with 4 of our partners and added a question, and we modified the session a little bit, and we sort of used some health projects and health equity projects as examples of ideas they could talk about. And we asked this one question at the exit survey, explaining that we're working to understand whether PB can make a difference in health outcomes. And we asked them if they believe that participatory budgeting can help all New Yorkers lead healthier lives. And in the idea generation, it was a small sample, about 80 or so people, but you can see the majority of them definitely believe, about 70, a little over 70 people, that they strongly agree with that statement. And then in the assembly members, the second graph you'll see there on the right, that's the people that you saw in the photograph before. We asked them the same question at the end of that day, of that first 5 hours of set meetings. And you can see they also strongly agree with a great majority that this is a possible thing, that PB can help all New Yorkers lead healthier lives. So that's sort of the very first data point, small samples, but it's overwhelmingly that people, and we want to delve a lot into where that came from and how they feel that way. But it's a really interesting result. Next. Now I'd like to introduce Muley. It's you're up. One of our partners on the ground who has been involved with PB both prior to working with Circle Keepers and now. But we just wanted to hear some thoughts about what it's really like just being there with people during these sessions and what people say. So Muley, thanks so much. Take it away.
No, thank you very much. Yeah, really, thank you a lot also for inviting me to be here and talking more from my experience. Yeah, my name is Mule. I'm from the Circle Keepers. We focus on youth and restorative justice. And I also come here as someone like, I actually start with the participatory budgeting as a community member. I got to know it through a town hall, and that's how I got involved with the Circle Keepers. And now I'm in the other side as administrator of a coalition with the Circle Keepers. So I got to see like the two sides of the coin. The coalition that the Circle Keepers is part of is in Sunset Park. So Sunset Park, we have our community is Latine, Asian, Arab, and like most of like our community, it's immigrant. So this is important because that time that I went to the town hall for me is like, as an immigrant woman, I think there's a limit that you feel you don't have a lot of power in this country because you are not allowed to vote. So it's like I don't have any type of agency because I cannot choose my governor or who is going to represent me. So in this town hall, it was a bit of how can we participate, or like any type of civic engagement or the agency that we can have as just residents here in New York. So I think this has like, first of all, like indirect impact on our mental health, because this was just happening. I got involved at the beginning of last January. Give me 1 second. Somebody's so sorry. Somebody's knocking on my door and like. So sorry. It was like the director. Okay. So what I was saying is that first of all, we get involved. So sorry. Sorry about that. So this has an indirect impact in our mental health, because first you are empowering the community by saying to them like, you have an agency towards participatory budgeting, because at the end, us migrants, we pay like through our IT, you know? So also by just saying like, right now we're passing through a moment that we think we have no power in our community or what's happening. So the way we were like passing the ballots, I think it was more coming from like, maybe you don't understand what is this, but this is just a way of you deciding what's happening in your city. This is a way of putting our voices out loud, of us migrants, we need this, and how we need it, and where do we need it. So first of all, this has an indirect power in our mental health, but also then we like when we think about like the creation of the ideas, that now is like the part that I'm seeing as an administrator. For the first time, I think last year, a lot of the ideas were more in workforce, but for the first time, we're talking about like in the ideas, they came up a lot of mental health. And I think it's because our community is being under attack. So also we saw more people are more willing of participating because of what's happening. I think people are looking ways of being more participant of what they can do, because also we cannot vote, but they're finding other ways of making their voice heard. So being members of the Borough Assembly, for example, and having a direct like agency of what type of programs do we need. And it's just interesting to see that a lot of the ideas that came out, it was like really trauma informed and cultural, like responsive mental health ideas, that is just not like a space of like therapy. It's like, no, a space that are like direct for like Latine. How do we know to heal? How Arab communities know how to heal, or Asian communities? But what is a reality is like, we were just in one of the sessions, and we were saying that to Benjamin the other day. We were in our sessions and ICE agents were outside the office, no? So being also part of these situations right now can be also like a trigger of anxiety. So how participatory budgeting, yes, it can be really helpful and have an effect direct in health equity. But at the same time, I think the context of right now, we need to think about how to adapt this civic process, where the ballots, we saw last year that asking a lot of information, people could get like, they're really afraid of giving their information. So how also this like civic process, we need to adapt it so it doesn't affect also this health, like mental health. And I think if we make it like trauma informed, I think we can like continue on the path of like really having a positive impact on the health equity. That's it. Sorry about before. And I hope it was useful, our experience from serial keepers and my own experience.
Thank you so much for sharing your experience and really showing like the human element behind this, and talking as a person who has both participated in participatory budgeting and what that meant for your sense of agency, and now helping to facilitate this for more people in your community and what you're observing that means for them. And I think you're spot on, right? Like in this time of crisis and fear, and when when a lot of people's agency is being directly targeted, how do we provide ways that they can come together in community and still share their voice? And what is the responsibility of folks in this room and the city government, and making sure that that process is a process that people can feel held and safe in. And our community partners like you all at the Circle Keepers are instrumental in making sure that people feel that way and can have their voices be heard. So this project would not work, I don't think, if it were just like government trying to push it down. I think those partnerships with the community-based organizations such as the Circle Keepers are what make it really come to life, because you are all the trusted folks in the community, that people know that they can go to your space and be safe and share their ideas back to the government. So thank you for being that space for folks. So I think if we go to the next slide, as you just heard, Mule made a compelling case for how this can impact both individual health and collective health. But this is research, so that's what we're trying to figure out. Does this have a chance at actually doing that, at improving health equity in our communities? And our hypothesis, based on stories like the one that Mule shared, and their perspective, and also what we're seeing from some of that preliminary data that Benjamin shared, is that it can, and that we can use this research to hopefully build a case to show that there is a path forward through these participatory mechanisms. And so after this year is up, we have some big plans. If we go to the next slide, we truly believe that everybody should have access to what we're learning, and this includes the participants that participated in either our research or the participatory budgeting process, and obviously community members across New York City and beyond, and also, the people who are in our city agencies, in our healthcare centers, in our public health institutions. We want to make sure that everybody kind of learns from what we're learning together. So we'll be working with our board to identify creative ways to spread the word beyond just using traditional academic journals that we're used to in public health to get the word out. And so this might include podcasts, print interviews, social media graphics, and we'll be continuing to identify different ways to get the word out. And along those lines, we do want to create a toolkit to help other locales deploy PB processes to improve health equity. We saw in the maps that Benjamin shared earlier that participatory budgeting is happening globally, but it obviously could be happening a lot more. And so how can we help to be a part of that fight for making sure that more people are able to say where their government dollars are going? And so we envision something that can be used in other cities or municipalities, but also in distinct agencies or organizations. Is there a way to scale this up or down depending on people's needs? And with appropriate funding, this would include key insights, processes from all phases of our study, as well as plain language summary reports, project-based data visualizations, tip sheets, decision support tools to guide implementation, and so on. And as you heard before from Neetha, we plan to synthesize what we learned from our sense-making work to actually develop something that is useful for multi-sector decision makers that they can use to inform their programming and their policies. We have all of this data. We have so many voices that are at the table lending their ideas, and how do we make sure that those voices are reaching decision makers when they're setting their budgets? And finally, we hope to build on this work and share study findings, the dashboard, the toolkit, and more at, a participatory budgeting for health equity summit in the future, modeled after legislative breakfasts that we invite policymakers and government employees and officials and external funders and public health and medical professionals and social service organizations and grassroots leaders or activists who are like really the heart of this work, to allow us to explore the potential for strengthening this across our country. So with that said, we have a number of people to thank, including everybody on our partnership board, and the Robert Wood Johnson Foundation and the University of Colorado for their support through this fund. And just a reminder that we're all in this fight for health equity together, and that we need to get ICE out of our communities. Thank you.
All right. I see lots of reactions there, Devin. Agreed. Is the rest of your team, I don't want to jump in and just assume we're ready to take on questions. Is there anything else from the rest of your team?
I think so. I just noticed a comment in the chat. I don't know if you want to address that right now.
Sure. Yeah. Do you want to address it, Benjamin?
Sure. Yeah. A couple of people in the chat have referred to the PB process providing funding for capital projects, which is true for the New York City Council process here. And I apologize if I didn't make it clear earlier. The people's money is expense projects. It is programs and services. It is mayoral funding. It has been historically around $4 million. Maybe it was 5, 4, but it's whatever the mayor decides to fund for programs and services. So our projects, as I said, health and well-being, education, they're things like mental health services that Mueller was talking about. They are job trainings. They are interpretation services for new immigrants. They are all programs and services. They are run for a year at each as they're funded in neighborhoods that are of high need. We have a series on our YouTube channel that has testimonials from the last 20 projects that were completed from each organization. There's 20 different videos. You can go and see them. So PB does not have to be just capital. I know somebody that said that Judy says that's not PB, but it is PB. And a lot of places around the world do use PB for expense funding as well.
Benjamin, that could be some really interesting resources to share in the follow-up email, some of those YouTube videos if you're open to it. And then,
Sure.
Devin, you were kind of talking to my love language of this work that we do at Systems for Action and working with our grantees and thinking about non-traditional avenues for products created out of this project so that you're reaching many different audiences. And so you're talking about these podcasts and a lot of these implementation guides and resources and inviting policy makers into the conversation, these kind of activities I just absolutely love. And if any of you here listening today are interested in seeing what types of products that this team is developing throughout their Systems for Action research project, I'm going to ask my colleague Sadina Belmashkin to include the project website page, which I just see has entered into the chat. Any products that come out of their their project will be listed on this project page. So could be a great page to bookmark and just visit periodically to see what the team is up to. Okay, is everyone feeling good about moving into questions? I know we got 10 minutes and I see about 6 questions that have been entered in. Okay, hearing no nos, I'm going to go ahead and move into the first question from Amber, which is what percentage of the budget does the PB have influence over?
As I think I said, this year we had funding of $4 million. That's a very small percentage, but it's $4 million.
Do you envision that
Project
changing in the future?
implementation. Sorry, go ahead.
Do you see that amount changing in the future, or is that pretty standard?
It is at the discretion of the mayor. So we would like, of course, to see it increased.
Great.
And I see Amber did follow up just wondering, and I know, Benjamin, you might not know approximately what percentage of New York City's budget or the mayor's budget that is, but they are thinking about replicating. So
it's a $115 billion budget. So 4 billion would be a very small percentage.
Great. Thank you, Devin, for noticing that. I had not gotten to that question yet. I'm going to move on to the next question from Chris. How did you reach out to made disadvantaged, in quotes, communities to promote their participation?
That's a great question. I think that we're a small agency. We have 25 members, but as we've talked about a couple of times, and as Julia represents, we use community partners, about 80 or so throughout the city, that are trusted messengers in hard to reach and marginalized communities. So we can't bring that message, and as you saw from that first poll, trust in government not really there. I will say that after a lot of our surveys, when we do before and after, the trust in the Civic Engagement Commission has risen, but not necessarily the trust in government. So that's an interesting thing. But we definitely rely on trusted messengers and people that are established in communities. We work with organizations that serve people with disabilities. We work public housing, and a wide range of different organizations that serve populations, veterans, justice impacted. So that's how we try to make sure we reach out. And we do multiple languages, as I said, as well as youth and older adults.
Great. Thank you, Benjamin. Moving on to this next question from Laura, which states, I can see that PB has been used to decide how to spend money. Has any part of the methodology been used, or could you see it being used in planning for implementation of projects to decide how to more equitably distribute the budget across and among those doing implementation?
Yes. Yeah, I think I'm trying to understand the question exactly, but the method of deliberation and using residents to make these decisions about how things happen, not only do they decide what ideas go on a ballot and then gets voted on by residents, but we encourage the implementing organizations to work with communities. And we have a pilot program really for one of our projects that is deeply engaging community members in the development of those service delivery processes. So, and I think that there's the assembly model that we use, which is based on citizen assemblies, which are another major democratic innovation, is often used to solve policy problems alone. They're in different circumstances. So I think that the methods that we use can be incorporated a lot in public input. I hope that answers the question.
I just wanted to chime in and say that with Pilot Project 2, we really do have the opportunity to amplify beyond. So even though PB right now, as Benjamin said, is a very small percentage of the overall city budget, we hope that we can make a compelling case to increase the amount of money that is allocated to participatory budgeting, but also use all of the data that's being collected to really amplify people's voices about what they care about and where they want to see money being spent, feeding it back to health systems, feeding it back to public health systems like the health department, feeding it back to the social services agencies, community-based organizations that are already part of or that may not be part of participatory budgeting right now. What we're learning from the people in New York, we can figure out how to package that, visualize that, make it accessible, share it back to the people who are making decisions in big, high up places like big decision makers about large amounts of money at a systems level. That's what we're really hoping to accomplish. So I just want to make sure that that's clear. So yes, it could inform budgets beyond specific projects within community-based organizations and these other systems that we've included. So we're really hoping that we can amplify what we learn.
I think that is an incredible point to make, Nita. And I'm wondering, as you're thinking about that and packaging some of the findings that are going to be coming out of your project, do you sort of know those pain points and like decision, I guess, what influences their decisions so that they would be more willing to budget more money for this? Like, do you have a pulse on that?
Yeah, I mean, I think whatever we can share, not only about our findings, but about the process, it hopefully will be make a compelling case for that.
Thank you. Okay, I'm going to move on to our next question here from Judy about including community-based healthcare organizations in your work. Can you talk about partnering or not partnering with those types of organizations?
It's critical. I mean, as we mentioned, hearing from Mule, the Circle Keepers is one of many community-based organizations that are currently part of this process that host the idea generation sessions, and that some of the folks from those organizations are part of the borough assemblies. They also encourage people to vote once the ballot is up in the spring, and so there are a lot of organizations that are already involved. But again, we hope to amplify and share what we learn to others. I don't know if anybody else from the team wants.
Yeah, and I will just say that those organizations like the Circle Keepers also sit on our board and are part of the decision-making process with us. They're weighing in on the survey tools, the interview guides. They're going to be doing the analysis with us. And that sense-making process is going to include community partners, grassroots leaders, and definitely folks who are in community-based healthcare organizations. We do have the Institute for Family Health on our board, and they are a group of federally qualified health centers, and we are also working with Health and Hospitals, which is the city's public hospital system. But yes, there are community-based healthcare organizations that will be heavily involved in that sense-making process and making decisions with us about how to get this information elsewhere.
Can I just point out that my colleague Wendy put our the participate.nyc.gov website in the chat. I don't know, the webinar chat. I don't know if that's available to everybody. But thank you for that.
We can share that in the follow-up email as well, so that you don't have to save it right now. Everyone, I promise we will grab that and include it in our email follow-up.
Also, I think I saw Muley come off of mic, so I don't.
Yeah, just to say that in our coalition, that is in Sunset Park, there's already 3 CBOs that they just focus in healthcare. So just talking about Sunset Park. So I imagine the other coalitions, they already have different CBOs. So I think for that part, like in all the process, it's already like covered from like the idea building and everything.
Thank you. Okay, I know we only have 1 minute left. I'm going to see if we can ask one final question, and I know that we have a few more that we have not addressed yet. So I'll share these with the presenters, see if you can respond to them in text, and we'll include those answers in the follow-up email. But the final question I'm going to ask is from Tahana. I hope I'm saying your name correctly, but how did you all convince city government to collaborate with you all on this and provide the modest budget that the people could control?
I assume the CEC was, as I said at the beginning, voted in by the residents of New York. So they made it mandatory. It's in the city charter. They have to have a commission. This commission has to run a PB process. So the funding we've gotten over the years, there was a move to get a lot more funding early on, but then right after we were founded, the pandemic hit. So we've gotten the funding we have, and we've done amazing work with it, if I may say so. We've funded, I believe it's 86 projects total, at least 68 with 68 so far, 20 more coming up. So there's been a huge impact. So as far as the funding for the project, you guys were nice enough to grant us this award. So.
Great. Thank you. I know we're at time here, so I'm going to go ahead and wrap this up. But thank you so much for coming and presenting in the series. I know that there was lots of engagement in the chat and both lots of in the Q&A. So lots of great questions coming through. So a lot of interest in your project. And we're excited to follow along with you and hear what you're learning about. So everyone that attended, thank you so much for coming and for engaging. And we'll make sure to follow up with you with the PowerPoint slides and the recording and resources and some of the answers to those questions we didn't have time to address. But thank you again, and I hope you have a great rest of your Wednesday.
Thank you, everybody.
Bye.